So next I'm going to assess the chest. So um, for the auscultation, I did the auscultation before for the breathing cells and lung cells already. So my baby doesn't have my baby doesn't have labored respiration. Um, and also I'm going to check the expansion and the retraction of the chest. So my baby's chest has um, symmetrical expansion and it doesn't have any retraction, which means that my baby doesn't have to like use a lot of force to breathe. Um, Next thing is I'm going to check the breast. So so I can see that my baby has symmetrical nipples and there's a slight elevation of the chest, which is normal for a termed baby. Um, and now I'm gonna move to check the heart. So I did auscultate for the heart cells before, and as I said, my baby has functional murmurs, which is normal for my baby right now. As long as after 24 hours that murmur disappears, then it should be okay. And there's no thrill, and the heart has regular rhythm and rate. Now I'm going to check the extremities and trunk. So generally, my baby's extremities are flexed and they move symmetrically. So for my baby's arms, they are equal in length and they have bilateral movements. So for my baby hands, I'm going to check the fingers on each hand. So my baby has 5 fingers in each hand, and the hands are in normal size. Um, to check the spine, I'm going to pick up my baby, and when I face my baby down, my baby should have a C-shaped spine, which is regular, and there is no abnormal indentation. So also, um, I can check my baby's hips by putting my baby on her tummy. So as I said, my baby has symmetrical buttocks, and my baby's hips are, which which can mean that my baby's hips are good. Um, and then after that, I'm going to put my baby on her back, and I'm going to do the Ardo Blaney's maneuver. So what I'm going to do is I'm going to press my hands on baby's knees, and then I'm going to move the knees um, up and then outward and then come back down, and then I'm going to do it several times. So um, I don't hear any click, which means that my baby don't have any hip displacement. So and also I can feel that the hips are normal. Um, Okay, so next thing I'm going to move to check the abdomen. So I auscultated the bowel cells before. So my baby has bowel cells. And now I'm going to look at the umbilical cord. So my baby's umbilical cord, there's a clamp on it, and we can see there's water jelly. So the water jelly right now is still moist, um, and if we palpate it, we can palpate the heart rate. So we're gonna wait until this water jelly is totally dry, and then we're gonna cut it off before the baby is discharged. Um, Next thing, I'm going to check the femoral pulses. So I need to make sure that the pulses are palpable, um, equal, and bilateral. And then I'm also going to check the inguinal area. So I want to make sure that there's no bulges along the area, and there's no any lymph nodes that I can feel. Um, okay, so next I'm going to check the genitalia. So to check the genitalia, because my baby is a female baby, so she's going to have mons, um, labia majora and labia minora. Um, and for my baby, because she is a termed baby, the labia is going to be prominent, and the um, and also the clitoris. So the clitoris is going to be not prominent, not prominent as the labia. And when I check the vagina, um, the urinary meatus and the vaginal um, orifice is going to be visible. Now next I'm going to check the buttocks and the anus. So my baby's anus is pain, and and the baby's buttocks, as I said, they are symmetrical. And next thing I'm going to check baby's elimination pattern. So first of all, I'm going to check the urine. So normally the baby will have one void in 24 hours, in first 24 hours. And then the baby should have two voids in the second day, three voids in the third day. And after a week, the number of voids should be more consistent, and it's going to be around 6 to 10 voids a day. For the bowel movement, oh, and also the urine, my baby's urine is clear, pale yellow, with mild odor, which is good. Next, I'm going to check my baby's bowel movement. So my baby will first have what is called meconium bowel movement. So this bowel movement is going to be sticky, black, tarry, and it might be hard to clean, this is normal. And then after a few days, the stool is going to change, and it's going to be it's going to change a little bit. And because my baby is breastfed, my baby's stool is going to be liquid. It's going to be like very liquid bowel movement. It has the yellow gold color, and it might be mushy. Now next I'm going to check for the jaundice. So so at first my baby should be like pink centrally, but she might have some cyanosis on hands or feet, which is normal for the first few days. And for the jaundice, my baby might have the physiological jaundice. If it is physiological jaundice, it should be normal. It's going to be harmless condition, and it's usually caused by the reduction of red blood cell production in 24 to 48 hours. So I can check the jaundice by blanching the skin, or look at the sclera, or look at baby's gums. And I also can use the Billy Flash. So this tool is going to be used to check baby's bilirubin. So we need to make sure that this level is not excessive. If it's excessive, then my baby might have jaundice, and we should be really concerned about that. Okay, so that is all of my newborn assessment. Thank you for your listening.